Most of us think of smell as a pleasant extra sense, something we notice when fresh coffee brews or bread bakes, but rarely anything more significant. Yet a mounting stack of research shows that your nose can act as an early warning siren for what is happening deep inside your brain. When the olfactory system begins to falter, whether by erasing familiar aromas or twisting them into something grotesque, neurologists now know that silent changes are already unfolding in the hippocampus and other memory centers. One large study, published in JAMA Neurology, tracked nearly 3,000 adults over 65 who had no cognitive problems at the outset. Participants were asked to identify 5 everyday scents, such as lemon, peppermint, or rose. 5 years later, those who failed the odor quiz were almost twice as likely to carry a dementia diagnosis, even though they had seemed perfectly sharp when the study began. That finding echoed a separate 2022 paper in the Journal of Alzheimer's Disease, reporting that an impaired sense of smell raises dementia risk as powerfully as hypertension or diabetes, yet few primary care visits ever include a discussion about odors. Why would fragrance perception be such a sensitive indicator? The answer lies in neuroanatomy. Nerves from the nose bypass the usual thalamic relay station and plug directly into the hippocampus and adjacent temporal lobe structures that catalog new memories. Those same regions are among the first to accumulate beta-amyloid plaques and tau tangles, the proteins that choke neurons in Alzheimer's. If toxic proteins gum up the olfactory pathways, the brain begins misreading or altogether missing aromatic information long before the damage is extensive enough to sabotage language or orientation. In effect, a warped nose can be the canary in the coal mine, collapsing well before the deeper tunnels fill with dangerous gas. One of the more common red flags is parosmia, the strange experience of detecting a foul, decaying scent where none exists. People describe opening a carton of just-purchased strawberries only to recoil because the fruit smells like spoiled meat, or they brew coffee yet perceive an odor reminiscent of garbage or sewage. Friends standing nearby inhale a normal, pleasant aroma. Only the affected individual suffers the distortion. Researchers who scanned such patients' brains found thinning in areas that decode olfactory signals, suggesting that miswired circuits are sending the wrong message to consciousness. Another subset of patients reports a damp, musty smell like moldy basements, even when the house is spotless. Again, no fungal spores are present. Instead, degenerating neurons fire erratically, creating a phantom picture that something is rotting. Phantosmia can also assume a smoky or burnt quality. A man might awaken at night, convinced something is on fire, racing through the house, searching for smoldering wiring that does not exist. Breath analysis devices show nothing abnormal in the room air, yet the brain keeps broadcasting emergency alerts. Neurologists from a 2023 cohort study concluded that recurrent phantom smoke correlates with later memory decline, and that the smell episodes often predate forgetfulness by 2 or 3 years. Even more unsettling is the metallic or rusty phantom odor some patients notice in drinking water, clothing, or the breeze. Investigators believe this specific distortion reflects oxidative stress inside olfactory neurons. When reactive oxygen molecules accumulate, the cells literally misfire, generating a false impression of iron. Loss of smell altogether may seem less dramatic than detecting foul phantoms, but anosmia is actually one of the strongest predictors of future dementia. A person notices that roses have no fragrance, garlic sautéing on the stove seems odorless, and suddenly the world flattens. Unlike the temporary anosmia that accompanies a sinus infection, neurodegenerative anosmia does not rebound. Longitudinal data show that disappearing smell precedes clinical Alzheimer's by up to a decade. Because the symptoms creep in gradually, many seniors blame seasonal allergies or aging mucous membranes, delaying evaluation until memory slips become undeniable. That lag squanders precious time when lifestyle adjustments and medication could slow progression. Sometimes the olfactory malfunction leans oddly pleasant, a persistent aroma of vanilla, caramel, or overripe fruit drifting through empty air. Physicians once dismissed these sweet phantoms as harmless curiosities, yet recent imaging reveals atrophy in the amygdala and hippocampus among people who report them. A case that garnered attention involved a retired teacher who spent months asking her family whether they had spilled honey or burned sugar. No one else smelled anything, but within 2 years she struggled to recall appointments and mislaid keys in bizarre places. Her neurologist later connected the dots. The brain areas that misprocessed sweetness were the same ones later riddled with amyloid. In the rarest but most disturbing scenario, individuals perceive a sulfuric odor, rotten eggs, burning rubber, even charred flesh, when nothing in the environment could produce it. One study found that this particular phantom correlates with rapid cognitive decline. Patients who smelled sulfur without cause deteriorated almost 80% faster than those whose smell loss was subtler. Researchers speculate that widespread frontal lobe damage, which governs both risk assessment and higher-order memory, produces especially grotesque olfactory hallucinations as the circuitry collapses. Families sometimes misinterpret the complaint as a psychiatric delusion, postponing neurological workups until the disease has advanced further. What should you do if any of these smell changes sneak into your life? First, track frequency and context. Note whether the odor appears in multiple locations or only one, and whether others can confirm it. Record associated symptoms such as brief confusion, difficulty retrieving words, or misplacing items. Second, schedule an evaluation with a healthcare provider who understands olfactory testing. Simple scratch-and-sniff kits can evaluate identification accuracy across 16 to 40 common scents. Missing several signals reduced risk for dementia prediction models in multiple studies. Third, undergo basic cognitive screening and, if warranted, advanced imaging. While no smell test alone diagnoses Alzheimer's, coupling olfactory deficits with subtle cognitive findings improves early detection dramatically. The encouraging news. Research from the Lancet Commission indicates that up to half of dementia cases could be prevented or delayed by addressing modifiable factors decades before symptoms bloom. High blood pressure and diabetes erode delicate cerebral vessels, reducing nutrient delivery to olfactory neurons. So, aggressive control of those conditions preserves both smell and cognition. Regular aerobic activity, 20 or 30 brisk minutes most days, boosts hippocampal volume and fosters neurogenesis, keeping odor pathways resilient. Sleep is another pillar. During slow wave cycles, the brain's glymphatic system flushes amyloid waste, and chronically short sleepers accumulate plaques faster. Diet matters too. Leafy greens, berries, nuts, whole grains, and fatty fish supply antioxidants and omega-3s that dampen inflammation, whereas ultra-processed snacks and trans fats accelerate neuronal injury. Social engagement and mental novelty act like fertilizer for neural networks. Joining a walking club, learning a second language, or even playing strategy board games stimulates the same temporal lobe areas used for scent processing. In one randomized trial, older adults who spent 15 hours a week in cognitively demanding activities improved on smell identification tests, as well as memory tasks, compared with passive control subjects. That suggests olfactory pathways remain plastic. With stimulation, they may maintain function longer, delaying symptom onset. Finally, pay attention to your environment. Chronic exposure to airborne toxins, solvents, pesticides, heavy pollution can damage nasal receptors and confuse the diagnostic picture. Protecting smell from external insults means neurologists can more confidently interpret any decline as a red flag rather than a nose irritant. The next time your morning coffee seems bland, or you keep catching a whiff of smoke no one else notices, pause before dismissing the experience. Your sense of smell is a fragile, exquisitely tuned channel directly wired to memory and emotion centers. Treat odd changes as you would sudden vision loss or chest pain, signals worth professional evaluation. By heeding those early chemical whispers, you can begin interventions while they still have power, safeguarding not only your nose, but the memories and identity your brain holds dear.